How's everyone doing? All right, well, we're going to have some fun before lunch. Thank you for bearing with us. I'm Dr. Geeta Nayyar. I'm the Chief Medical Officer for Salesforce. I go by Dr. G to keep it easy for everyone, including our panelists. And we are going to be talking today about health beyond healthcare. What do I mean by that? So first of all, we've all been through a global pandemic. It was not fun, I think, for any of us. And perhaps the only silver lining of the pandemic was that we've all really rethought the concept of health, whether in our own families, whether in our communities, or whether as big employers here in Arkansas. And you're going to hear directly from my colleagues here today. But the concept of healthcare is way beyond the doctor's office, way beyond the hospital, and way beyond the emergency room. Does that resonate with everyone in the room? Does that make sense? All right, awesome. So get ready for some fun. I'm going to first have our panelists introduce themselves. Dr. Claudia, go for it.
Hi, I'm Dr. Claudia Coplein, and I am the Chief Medical Officer at Tyson Foods.
Hi, my name is Mark Greenway. I just retired as Senior Vice President of HR at JB Hunt, and now I'm Senior Advisor at the company.
Hi, I'm Joanna Thomas. I'm a family physician, VP of Clinical Strategy and Population Health at Arkansas Blue Cross Blue Shield.
And I just have to tell you, we took Mark out of retirement for this panel. That's how important it was. So he's actually subbing in for our previous speaker. So thank you for that, Mark. All right, so our first question is actually for Dr. Claudia. And I'm having a hard time with your last name, which is why I'm saying Dr. Claudia. You know, we've talked a lot about trust during the pandemic. There was a lot of information out there, both good and bad. And really, so many of us were asking ourselves, and our employers, right, the big companies that we all work for, doesn't matter if we were in the food business, the logistics business, the payer business, or the tech business like we are in Salesforce, we know that when employees make good decisions about their healthcare, informed decisions about their healthcare, about mammograms, colonoscopies, vaccines, the cost goes down and the outcomes are better. And so my question to Claudia is, as we think about the era of misinformation that we're living in, if we think about who the consumer out there or the employee out there can turn to trust about their healthcare, where does tech fit in? Because so much of the conversation during the pandemic was, you can't trust social media. You can't trust tech. And as someone who works for a CRM company, there are so many things that we personally did, our business certainly did for providers out there, to scale that doctor-patient conversation and actually scale good information. So where's the good, the bad, and the ugly in where tech fits into that?
Yeah, I mean, that's a great question because certainly the healthcare industry has been tremendous beneficiaries of the proliferation of technology. But with the abundance of health information that's available online today, it can be really hard for people to understand and know what's true or not. Health misinformation, which is information that is inaccurate or false or doesn't come from credible health sources based on the evidence that we know at the time the information is available, is really a serious threat to public health. I mean, it could lead to harm. Confusion, mistrust is a big issue, and we see that with our employees. And in some cases, it can even harm patient health. During the pandemic, health information or misinformation was really a big problem because it led people to decline vaccinations. They rejected public health measures like masking, and in some cases they even tried unproven treatments when they had COVID-19, which led to unfortunate conclusions in many cases. And also it's led to, in some cases, harassment against healthcare professionals who are really just trying to do the right thing during the pandemic. And this is kind of the first time in my career as a physician where we weren't necessarily seen as the trusted resources because people were getting their information from places other than the medical community. And social media was a real big factor in the spread of misinformation during the pandemic. It's difficult at times to combat misinformation. It takes a tremendous amount of resources. I mean, you have to listen, you have to understand listen with empathy, understand, try to provide correct information, and build that level of trust with the person to, get them to do the right thing or accept the, correct information. And it's very labor intensive, and that's really led to a lot of burnout amongst the healthcare community, because you're really, in many cases, fighting an uphill battle. So, some of the things that tech companies and technology could do to help combat the spread of misinformation, and I jotted down a few that were on the top of my head, is, first of all, strengthening the monitoring of misinformation. And, it kind of went unchecked, particularly in the early days of the pandemic and even after vaccines were launched, and that caused a lot of problems. Prioritize the early detection of misinformation and super spreaders. They need to be found, and repeat offenders as well, and try to shut them down to the greatest extent possible. Proactively address information deficits where they exist. Amplify communications from trusted messengers and subject matter experts so that the information that's out there, including on social media, is correct and accurate. And also find ways to protect health professionals and other credible sources from online harassment, because that became a huge challenge during the pandemic and really shut down a lot of people from providing correct information.
Thank you, Claudia. Go ahead, Mark.
I'm going to jump in here. With all due respect, I'm going to push back a little bit on shutting misinformation down. I think we need open, informed debate in this country sometimes. It's hard to define misinformation until you shed the light on it and have a reasonable debate. So I think sometimes we're quick to shut things down. The idea of misinformation is nothing new. It's not new with COVID. If you think about it, we can ask questions about the efficacy of certain drugs that are out there that pharma pushes. We can also talk about the fact that, in healthcare right now, there's a RAND study that says up to 40% of the time you're receiving treatment. It's either the wrong treatment or the right treatment done poorly. There's a lot of opportunity in the data space. And I think that's why Blue Cross has jumped in and is even funding a master's in health analytics at the University of Arkansas next year.
Yeah, and one of the things we're really trying to do at Arkansas Blue Cross is healthcare is notoriously difficult for people to navigate. Just so confusing. What we're trying to focus on is how can we make it easy for people to navigate, use technology you were talking about, Geeta, how they get their mammograms, how they get their colonoscopies. They know how much they're going to cost. They know how much their out-of-pocket is going to be. Using that technology in a way that is really easy to navigate. Someone in one of the other conversations this morning was talking about different platforms, and we're really focusing on the interoperability because, as you all know, if you have multiple doctors, the chances are their electronic health records are not talking to each other, they're not connected to the hospital. When we can get all of that information in an interoperable space, in one space, it's going to be easier for patients, members, employees to trust where they're getting their information from.
Yeah, and I would agree with that. I think the interoperability, the ease of accessing healthcare information certainly helps to build trust. It also makes people more eager, I wouldn't say eager, but less anxiety prone in accessing the healthcare system. The key is just making sure that the information that's available, and I get your point about debating, and but we have to make sure that when we have the debate, we also provide the correct information, because there are a lot of unproven treatments out there, and that sort of thing sometimes gets magnified in the wrong forums and without the ability to check that information and make sure that the debate is out there. But overall, I think our employees, when they have the access to the information, when we make it easy for them to access the healthcare system, whether it's through telehealth or telephonic health information and accessing their providers that way, it makes for an overall better experience and ultimately better outcomes.
Yeah, the transparency of information is the hard thing right now. If we try to define quality in healthcare, you ask 5 different payers, providers, what quality is, and you're going to get 5, you're probably going to get 10 different answers, and we can't agree on what quality is. So we need a data-driven approach to really understanding what the clinical pathways are and what the right treatments are.
So a lot has clearly changed, and you can see my panelists are very shy. They're holding back here. So a lot has changed, and what I heard in all of your answers is that technology will be used even more as we think about combating misinformation and perhaps propagating misinformation. So it's important that we think about that. So Dr. Thomas, my next question is to you. As we're on this talk track of change, how have things changed from your perspective? You come from Blue Cross Blue Shield. You've been a physician for a long time in your career, particularly in academics. What has changed, particularly talking about behavioral health, mental health, and as you're thinking about your employees as well as your customers?
Right. One of the first things we saw when the pandemic hit was this huge takeoff in patients, members accessing virtual care, but this huge takeoff in them accessing behavioral health care as well. You know, probably, or people neglect their behavioral health, their mental health, for many different reasons. Stigma. They don't want to use precious PTO to take off half a day to go for a therapy session. There are shortages of providers. As soon as COVID hit, we saw that take off in virtual behavioral health. COVID came down, the access to the medical claims started to come down. People are going back to bricks and mortar, reconnecting with their physical physician, but we still see this uptick in behavioral health. To your point about quality, it's yet to be determined what the quality is like, but we do know that people are suffering from anxiety and depression right now, and since COVID, this is a much bigger problem. The reasons are very complex, and I wouldn't profess to have the answer on why that is. But I do want to share with the audience, we can't ignore technology as a solution for the challenges of behavioral health, mental health. I also want to throw something out there as well. Pediatric mental health, children, a lot of anxiety out there right now with our children. How do we use technology to solve for some of this? Because we can't turn on a faucet and all of a sudden we're going to have a whole lot more pediatric psychiatrists. It's going to take a long time before we solve for that.
Mark, you have any thoughts on that one?
I can always dive in on a lot of these. I see technology as a real enabler moving forward, okay? I think we see a world at some point, you'll never replace the brick and mortar hands-on of a doctor or even the face-to-face counseling, but using technology as an enabler, an extender, I can see a benefit plan design where we have a virtual front door with a PCP, maybe even a behavioral health PCP hybrid who's assessing the person and then using technology and an EMR to decide, okay, what's the history of this person? What medicines are they on? Who else have they seen? Using technology to then determine the correct treatment pathway, and also using technology and data to say, I need to refer them to a live person. Here's the person who's the best at managing diabetes in their region, or here's the person that's best for hip replacement, whatever the case is.
And also, you raised some really good point, because one of the things I really think we need to be looking at is how do we develop new care models? You know, I spend a lot of time talking to technology companies, advising venture funds, things like that. One of the big mistakes I see is people start at the bottom and say, let's innovate. But really, when it comes to healthcare, the best way to start is at the other end and say, what's the clinical problem? Who are the people who are having the problem? How do I design a program, a care model that's going to address that problem? Okay, what are the signals from the data? How is that going to reinforce what I want to do? Okay, right, let's innovate. Let's go from there.
Go ahead, Dr. Coplein.
Yeah, and I would add to that, you know, particularly in the behavioral health space, you know, a personal story is early in the pandemic, as many children and high schoolers and college age kids started, you know, having mental health issues. I mean, there's a crisis of loneliness and the social isolation from their classmates, et cetera. One of my own children was starting to experience that, and I knew she needed more help than I as a mother could give, but I could not get a local appointment for mental health professional for months and months booked out. Fortunately, in looking at her benefit plan, there was a tele-mental health program that was available where she was able to have therapy online, on her phone actually, on her iPhone, which was great, and transition to a point where she could just text back and forth with the therapist on an as-needed basis to get through, moments in the day or certain crisis situations. And it was just a huge asset. And those sorts of platforms, I think, really need to be multiplied and magnified and offered as benefits to all employees.
That's terrific. How's she doing now?
She's doing great.
Excellent. So in that spirit, as we think about large employers such as the ones we represent, we're going through a tough economic climate. Healthcare is a big cost on every company's balance sheet. How do you have to evolve your benefits? How do you have to evolve your benefits to meet the needs and demands of today to ensure you're actually reaching your employees? And I know tech is famous for the ping pong tables, right? I'm pretty good. Anybody wants to play later, let me know. But beyond those benefits, right, how are you thinking differently about the benefits you offer, where they need to go, and sort of how that looks? And Mark, we'll start with you on that one.
So many opportunities. The CMS data, Center for Medicaid Services, would suggest that there's an inverse relationship between cost and quality. In other words, the higher the quality, the lower the cost, which is kind of counter to what we think of. We think buy a Mercedes, high cost for high quality. Healthcare really is quite often the opposite. If we can drive for high quality, we get low cost. So in this world of tightening pressures, we want to go out and seek quality any way we can. So whether it's working with companies like perhaps Embold Health, that was an initiative we have going with Blue Cross and Walmart and Tyson's in Northwest Arkansas and the hospital systems around identifying quality, or whether it's investing in digital products like Livongo or Virta, which provides specific chronic disease condition management, where we're identifying those high-risk spenders, and then we're going in and coming along beside them to help them with their nutrition, their exercise, their medical care, their prescription compliance. We use technology different ways to drive costs down. And as a health plan sponsor, we look at the world a little differently than an insurer, because I look at putting money into a program saying, where's my 4 to 5 year return on investment? If I'm going to spend money on a chronic condition management program, I need to get ROI out of that in 4 to 5 years, because that employee is going to be gone in 4 to 5 years. I can't invest a bunch of money now and hope that I save money when they turn 60 or even 80 when they've retired. It doesn't happen. So, and part of my responsibility is not just to provide great health, but also keep our premiums low for those employees on the plan. If we spend a bunch of money, don't get return, healthcare costs go up. So it's an interesting idea of looking at short duration return and using technology to leverage and achieve that.
Go ahead.
So one of the things we're doing, to Geeta's point, healthcare is so much more than going to the doctor's office and the visit. So much more happens beyond that. And patients and members need a lot of help with education. A huge burden right now in our country is chronic disease. The average person with diabetes goes to the office 3-4 times a year for a checkup for 15 minutes, and yet the sphere of the disease is so complicated in terms of diet, medication, lifestyle. We're looking at solutions that support members along those journeys, make the journey more easy to navigate. One area we're looking at as well is prenatal care. We've got a huge problem right now in our country, many of you will know, around adverse maternal outcomes. The average patient has about 10 prenatal visits for about 10-15 minutes, a couple of scans, but we know things can go wrong quickly. How can we provide tools that provide information, education? This is a huge part of healthcare that we need to be thinking more about.
And then also from a large employer perspective, benefits are expensive and they're also confusing. And there are many add-ons and different platforms, and to the extent that we as employers can provide a solution, preferably a technology solution, because people have phones and are ready and willing to use those, a solution that helps them navigate the different benefit choices and options so that they're getting the right care at the right time from the right organization that's preferably high quality. So those sorts of enterprises like Accolade or Included Health that really meet people where they are, find out what the need is, and then connect them directly to that need, rather than them having to figure out all the different benefit options that are available to them, if they remember them, if they know where to find them. But again, having that all in one place in a hub that steers them in the right direction, I think is really critical to maximizing, what we're paying for benefits, but also maximizing employee health.
Completely agree. I'm a big fan of both Accolade and Included Health. In addition to that, another place technology plays a key role is even in the very beginning as an employee, trying to decide which health plan do I choose. Do I choose an HSA, a high deductible health plan, a PPO? And there are AI tools today that will look at your claims history, your position in the company, your salary, your income, your age, and the tools will help you decide, make a recommendation, if you will, of which benefit plan is best for you. Again, decision support.
Dr. Thomas, you look like you had something to say.
Also a big fan of Accolade and Included Health, because at the end of the day, having that next step for the member as well to guide them, and we know it can't be on the phone, has to be technology, has to be easy to navigate. If you've got that algorithm to how you pick the bet, I need that, because I can't seem to give up my PPO plan, and I'm not on any meds.
So we know we are the last thing standing between you and lunch, so I'm going to ask the final question. So we've got a lot of folks here from the technology space. We have a lot of big employers from Arkansas here as well. What's your one advice? I'm going to ask every panelist to chime in here. What's your one piece of advice going into the new year as to how you really focus, reprioritize health beyond healthcare and make that the biggest priority of the year, that one thing? And maybe we'll start with you, Dr. Coplein.
I would say keep innovating, find better, faster, quicker, more accurate ways to use data and improve the overall quality of healthcare that's delivered.
Well, since I've already talked about quality, I want to say that we need to focus on the whole person. It's kind of almost ludicrous to some extent that we think about eye care as one thing, dental care is something, our body health care is something else, and behavioral health is something else, when we're all one person. We need to look at the whole person, including exercise, diet, all the social determinants. I think as we look forward the next 20 years, it'll be much more of a whole person world.
I think as well, I say this to my staff all the time, the brain's connected to the body, the whole body's interconnected, all of the organs. One of the things I think is really important is that experiences are uniquely personalized. We know from some of the early health tech solutions like text messaging, people with diabetes 10, 15 times a day, it didn't work. People didn't want it. So however, as you're innovating, that you can personalize the experience for that particular patient, that's what gets that engagement in the end.
And I'm going to tie in to say, do all of the above, but also investing in that tech infrastructure for the long term, not the short term. So much of what we saw in COVID was a lot of point solutions, a lot of, hey, for the moment, I'm going to invest in this and that. And I think we've gotten the message that healthcare, the issues around healthcare are a priority. They're here to stay. And to keep your employees happy, thriving, and productive, you've got to make that investment. So with that, I want to thank our panelists. I want to thank NWA for making healthcare a priority and on the agenda, specifically Chris Adams. Thanks so much for having us. We hope we'll be back bigger and better next year, so we're going to hold you to it. Thanks, everybody.
Thank you.